we'll go ahead and start that now. Perfect. Do be thinking about questions kind of as we go. So we will have a small presentation from the Denver Human Services team where they'll talk about some of the rates, some of the changes, do an introduction of the team. So if you are kind of wondering, who do I contact for a new fiscal agreement, and who do I contact about specific case questions, and who are all these, what do they do? We will get to that and we will go through that. Then they'll do a little bit of talking, and then towards the end we will have probably a fairly substantial amount of time for you guys to ask questions. So if it's like super specific, this probably isn't the place and time for that, but now you'll know who to go to. So if you're like, we have this family, the mother works this many hours, but we don't need to get into all that right here, but you will know who to contact for that after this. If you have any larger scale questions, like how do we get parents to utilize the ATS, or, how do I run a report about whatever, we can at least try to answer that or give you some guidance. So with that, I will pass it over to, I should introduce myself. My name is Dora Esparza. I'm the Director of Business Services at the Denver Early Childhood Council. I know most of you. I do coaching for directors, primarily around leadership management, administration. We have a financial coach on my team, so we kind of do that, basically a classroom coach for directors. So that's kind of my role, and I will pass it over to Orvalette. Orvalette, go for it.
Hi, I'm actually going to pass it over to Tasha Small. She's going to do the introductions for the county. You're muted, Tasha.
Thank you. I could have sworn I hit that button. Good morning, everybody. Thank you, Orvalette. My name is Tasha Small, and I am the operations manager at Denver Human Services over the CCAP program. So I just want to start by thanking you all for allowing us to be part of this meeting and to share some information with you all about Denver Human Services and our thoughts and plans on moving forward. You may have noticed there's quite a few of us here today, more than usual. And so I want to take a second to just let you know who all we have on the call. We have Clint Woodruff, who is our CFO. We have Judy Ligorio, who is our Deputy Executive Director. I believe we have Dana Niemela, who is our Division Director. Myself, and then we have members of our business office, which I'm pretty sure you're all familiar with, Angela, and then our eligibility team, Orvalette. So again, want to thank you all for giving us the space to chat with you all and share some information. We do have a small presentation. We are going to be dropping an email address in the chat. So after this presentation, if you have questions, comments, additional information you want to share with us or thoughts, please feel free to email us. If you are interested in maybe having a smaller conversation around your specifics or other information you need, you can reach out to that email address also. So with that being said, I'm going to go.
Tasha, can you give us just a quick description of what the eligibility side kind of manages and then what the billing office side kind of manages, just so we know kind of what those two sides are and the details of the areas or the specifics that they serve?
Yep, I will do that. And I will also just, if I misspeak, I've got my experts here. So ladies, please feel free to jump in if I misspeak. So our eligibility side does the processing. Okay, so they are the ones that get the referrals from the families. They process the authorizations for our families to attend care. We do have somebody on the eligibility side who does work with providers. Tiffany, who I'm sure some of you are probably familiar with, who does build a relationship from our side with our providers. When it comes more to the billing and the, trying to think of the right word, Angela, the billing and the contracts, that's more on the business office, which is on Angela's side. Is there anything, Angela or Orvalette, you guys would like to add to answer that question?
The business office is manual claims, fiscal agreements, and recoveries. Orvalette and Yvette are applications, redeterminations, changes, anything related to changes of the family's cases.
Thank you, Angela.
Mm-hmm.
Before I turn it over, are there any other questions for me? All right, well then I am going to go ahead and turn it over to Clint Woodruff, our CFO.
Hello, everyone. Thank you for having us today. I was gonna talk briefly about some items and then everybody else can go into some more detail about all of these items. But as many of you may know, the feds changed some rules regarding our child care program this year in March of 2024, I believe was when they released their new guidance. And the intent there was for the to increase childcare access, affordability, and importantly, to stabilize the childcare sector for the vendors themselves and provide additional funding for that. I say additional funding. They actually have not yet provided any additional funding to go with these new rules. All of the changes are going into place, but the funding is actually not changing. For Denver, actually, and it is decreasing in this upcoming year, and that's because of the ARPA funding ending. And so we're going back to what our base allocation was with just the CCDF funds, the CCAP program itself, with no additional ARPA funds. So we have some cost increases that are going to occur for some revenue increases for the programs, or cost increases to the allocation that are going to occur in this upcoming year without yet having received any additional funding. We are working with our state and federal partners to try and match the new rules with the required amount of funding to maintain the current services and level of, if not increase the level of services that we provide in upcoming years. But as of right now, that has not yet happened. So I was just going to talk briefly about some of those financial changes that are going to occur starting October 1st here next week. The first part that will change and occur immediately on October 1st is that you will see an increase in the rates. What that works out to, according to the statewide projections, is about $6.8 million more in provider rates across the state. And that is repeated each year for the next for this year and the 2 following years. So for 3 total years, we'll receive increasing in their rates. That's different for each. I can't tell you for each exact vendor what your rate is, like sitting here on this call, because there's calculations and what have you that go into that based on you know, all the various factors that determine rates, you know, what the age of the child is, how, you know, if it's all day or you know, only after school, if what quality rating, all those things go into determine the rate. But the overall rate increase per the state's calculations about $6.8 million across the state. We believe that to be, at the end of the 3 years, about a 33% increase in rates total from what we're paying today. But we will see how that plays out. That is our initial projections for Denver specifically. I don't know what that will be for everybody across the state. I've already mentioned we have these increasing rates. We have other changes that will be forthcoming. For instance, in future years, either the next year or the following year, some of the changes that will occur are the limiting of the parental fees from 14% to 7% on their contribution. And then another significant change that will happen in the 3rd year is that we will be moving to payments based on enrollment versus attendance, and my colleagues will talk about that a little bit later. Those are the kind of big overarching. There are a lot of programmatic and different other smaller changes that are occurring in these rule packages, and the state has put out on their website kind of a listing of all of those things that they propose for rule change as a result of these changing packages. But these are the ones that are going to specifically impact us financially in the near future and over the next 2 years. That is mostly everything that I just wanted to touch on and kind of set the scene of where we're at environmentally. And then I know other people on our team are going to talk about the other categories. But before I move on, is there any questions about the other financial changes or something that you had a question about that I maybe didn't touch on that you wanted to hear about? Okay.
Well, I
Then
had
we-
a question in
yeah,
the
go
chat
ahead.
about
Oh, I didn't see it.
with the new changes, when and will they receive a new fiscal agreement with the new rate?
So when I think Angela and Karen will talk about that here just in 1 second. So that's forthcoming as part of our discussion here.
And I can go ahead and answer that.
Yeah,
You
sure.
all will not receive a new fiscal agreement, but we have been completing the rate increase project, and Denver County is currently completed with ours. So you should have received an amended rate increase with what your new rates are. If you have not received that, our email address is in the chat. Please email me and we can go ahead and resend that to you.
Anything else before we hand it over to Karen and Angela to talk about some other potential impacts? Okay.
We have a question in the chat about for a new family childcare home, how can we set up the amount to charge? Rhonda, the end. So if you have questions that aren't specific to what we're talking about at the moment, then let's add those to the end, because we do have a fair amount of time towards the end of this to be addressing questions.
Hi, everybody. I'm Karen Kinblade. I see that there's another question, and we are this next question about the rates that don't look quite right. Ange, will you make a note of that so we can look into and connect back with this provider directly? Do you know what center this is?
I do not, but I'll write down your name.
Arachna, I'm sorry if I'm saying that wrong. Will you just pop in the chat like what facility you're from so that we can make sure that we're looking up your exact information when we research what's happening with your rights? Excellent. Thank you so much. Hi, everybody. I'm Karen Kinblade. I am fiscal administrator here in the Financial Services Division at Denver Human Services, and I have been working with the CCAP program for a little over 3 years now. I stepped back a little bit for a few months here early in 2024 as Denver was as you might have heard in the papers, we had a bit of an influx of folks from our southern border that the city of Denver was working to help make sure that their needs were met. And so I stepped away a little bit from childcare to do some work on that. But I'm pleased to be back here. So I haven't been to one of these in a few months. So I'm excited to touch base again. So here we are. Clint laid out the financial changes, and as you can tell, there are going to have to be impacts when we're kind of the landscape right now is that our allocation has gone down, but some of our obligations have gone up. And so we here in the county are exploring all the different options for how do we make those two lines connect. To be transparent, we are exploring reducing the number of absences. Right now, Denver pays up to 8, and we will likely be reducing that number, but exactly to what we're not sure. We're still crunching the numbers. We'll give you 30 days notice for sure, if not more, when a decision is made on if change is happening there. Similarly, we are exploring putting a cap in our on our enrollment numbers. We haven't had to do this. I mean, certainly not in my time. Orvillette and Ange maybe might know if this has happened historically. Again, we're evaluating what all the options are so that we can meet our financial obligations with as little negative impact to providers as possible. Any questions? I know I said two things are going to change, but I can't tell you how. Any questions? I get that's kind of that's a little difficult, but we want to be transparent with where we are in thinking of these things.
Karen, I'm seeing on this chart that it says in August of 2026, the childcare payments will be based on enrollment versus attendance. Can you give a little bit more detail, possibly, if you know, about like what that really looks like, or kind of what the difference is between the enrollment and attendance?
Yeah, forgive me. Ange, do you want to answer that? Thanks.
So the difference between enrollment enrollment payments and attendance payments is enrollment payments are once the child is approved for CCAP, then the provider is able to get paid. Currently, we are attendance-based, meaning that the child has to actually use their ATS system to punch in and out, and we'll pay the provider based off of the days the child has attended care. Unless there have been absences, then of course, right now we're paying up to those 8 absences. Any questions on that?
I'm a little unclear on that. So currently at my center, all the parents do use the ATS system. So we would be under the attendance model, but
Yes.
moving forward, it would just be based on their enrollment regardless of attendance?
Correct.
Or, I mean, okay.
Yes. So I think they're also working on paying you guys in advance. So instead of, I think right now it's you guys are paid weekly, 2 weeks in arrears. Moving forward, then you guys would be paid monthly at the beginning of the month. And so same thing applies, like if there's any changes where the family has disenrolled, where you guys are seeing trends that the families are having like consistent absences over that 8, then of course you still want to notify us. Because of course, if that child is not attending or if that child has disenrolled, we don't want to continue to pay, you know, that could be another family that's in that spot. So we want to make sure that we're still being fiscally responsible and having those families that are actually attending being paid for those services.
So while none of this is firm, I'm wondering about considering taking the absences down to 4. And I guess my only concern for centers is that when some of these little tykes get sick, like with a bad flu, an infection, 4 days is not enough. 8 days I thought was reasonable, but how would that be handled? Could they stay enrolled and then does something happen with their how they pay or whatever if they have to go over the absences? Or potentially are you guys considering a legitimate excuse for them being like not going out of town for 8 days, but this child was, you know, chronically sick or was sick 1 week and then sick a couple days here and a couple days there? Is that something you guys are considering?
So right now, as a center director, you do have the options on how you run your business. So right now, if you have a family that goes over the 8 absences, you are able to you are able to charge them for those absences over 8 days. The caveat is it just has to be at the CCAP rate. So if they're missing those 8 days, you can't charge them your private rate for the days that they're over. And so it would be the same with the 4 days. If they go over that 4 days, you can charge them for anything over the 4 days as long as you're charging them at the CCAP rate.
But how does that affect it? I mean, if they go down to 4, does that affect if you're going on enrollment, is that something you just kind of take our word on, or how does that work?
We would be taking your word on it. And so yeah, we just ask that you guys be honest, so you know
I
that
don't think that's a
we're
problem.
fiscally responsible.
Yeah, none of us wants the kids to go on that much anyway, and it would give us a little leverage with the parents by saying, you know, hey, if this is not legit, if you're just going to Mexico for 3 weeks, yeah, that's not gonna do it. And none of us want that. So I just wanted to clarify because I was a little concerned when I saw going from 8 to 4, just watching how some of the flus and everything have gone. in the past year. Thank you very much. Appreciate it.
You're welcome. And another thing that will be added in 2026 is the slot contracts. And so we'll speak about that later too.
So Lucy, I think the absence consideration and the potential absence change is probably a more immediate thing, and the enrollment versus attendance changes aren't until August 2026, it looks like. And I think before COVID, it was, I think, like 1 absence a month or something. So it went up substantially from COVID, and I think that's kind of where this the residual, like 8 absences a month, is coming from.
Just to clarify, the changes from 8 absences going to 4 would be just this upcoming year, and then the following year it would change to enrollment, not absences, correct?
So we don't have a date on when we will actually be changing the absences. We're still, again, working with our state and the mayor on those, but we will definitely notify you guys of when that will happen. It will be 30 days before, if not more notice. The absences, those will go away potentially in 2026 once we change over to enrollment base.
Thanks so much.
You're welcome.
I have another question. So once that shift to being enrollment-based happens, does that mean that the ATS system would be done away with? Like we wouldn't have them sign in every day, or?
We haven't gotten that far yet. I believe that ATS would probably still be in place because we do have to still track the attendance. So what that looks like as far as how we track the attendance, we haven't gotten that information yet from the state.
Oh.
Any other questions? So I'll go ahead and pass it to Orvillette.
Hello, everyone. I'm off camera because I am sharing my screen and it is slowing my computer down. So I hope you can all hear me. So just a couple of changes coming up for clients, just for you to be aware of. There's going to be revisions to the application and redeterminations. The state is constantly working on making this an easier process. As you have seen over the years, both of these documents have grown significantly. So they're looking at shortening it a little bit, just making it easier for clients to navigate. Also, something to think about, Denver is contemplating a freeze or a wait list at this time. As many of you know, you work with other counties, and some other counties have already either gone on a wait list or a freeze. And I just kind of wanted to give you the difference between the two. So for a wait list, we would keep a current list of applying families, and those families would have to complete the entire application process. They still have to be eligible for on that list every 6 months by self-reporting their income and or activity, just to ensure that they're still
again, because you kind of broke up
Sure.
kind of at that last part. Sorry.
Sure. The freeze, in regards to the freeze, counties can shorten the application. They don't have to use the state mandated application, and they must recertify every 6 months, reporting their income and activity to determine they're still eligible for the program. So those are the two big differences between the two, either a freeze or a wait list. Again, Denver County has not made a decision yet. We are leaning towards a freeze, but of course, that information will be told to you guys at least 30 days in advance before it happens. Are there any questions or comments about that?
Can you repeat the wait list? What is the redetermination period for wait list again?
It would be a 12-month redetermination period. So what it is right now.
Okay, thank you.
Or Villette, do you know if you guys went on a waiting list, how you would prioritize who is coming in from the waiting list?
Yes, we can. once the waiting list is in effect, we can bring clients in based on homelessness, if they're under 130% income, and teen parents. We can start there. Then the county has the option to select categories. So we can say those that are job searching or those that are employed. Every county has an option on how they can bring those clients in off the wait list.
I have
I'll
a
just add, we
question.
haven't, oh, I'm sorry.
I have a question about if the place is unlicensed. I've heard that CCAP pays for, on the care for those students. I wanted to know, I don't understand this wait list. What you mean by the wait list? Meaning that if one of our students apply for the CCAP, you have a wait list, you do not automatically enter them to the program, or what
That
does
is
that?
correct.
Okay.
That is correct. If we enact a wait list or a freeze, that family would have to wait until basically another family falls off before we can bring them on and offer them care.
Okay, so is this wait list based on the how much money you have, or how many openings are out there for the parents to apply? I don't understand.
It's based on the money that the county has to pay for the care.
Okay. And then for the non-licensed places, how that would work?
So I don't think I understand your question. So it
Okay,
depends.
so I understand that there is family friends program out there that they can have 4 students and they can apply for CCAP for their students. And I wanted to know what is the procedure for that and how much you pay per student.
So you're talking about an exempt provider. So Angela, do you want to take that?
So the friends and family is also considered a qualified exempt provider. With those families, they would have to apply for CCAP. They would have to list the friend or family as the provider that they want to have care for their children. Once we get that referral from the CCAP department, then we will reach out to that qualified exempt provider with the application that they can fill out. Once we receive that application back, then we'll send that application to the state. At that time, they will conduct a background check, make sure that the provider is able to provide care for them. Once we get the approval from the state that that their application has been approved, then we'll go ahead and send out the fiscal agreement for the qualified exempt provider to go ahead and accept the terms. Right now, as of today, our rate is $24.18 that we pay per child. As of October 1st, that rate will go up to $24.30.
That's per child per hour, right? Or per day?
It's per day, per child.
Okay, per child. Okay, thank you.
You're welcome.
Are there any other questions regarding that? Okay, if not, Tasha, I don't know if you want to talk about the changes that we're trying to make in regards to processing and.
Yeah, I'll share a little, a little more information. So as Orvillette talked about, we're still trying to make a determination whether we're going to go freeze or wait list or what that's going to look like. But before we make that decision, we are going through a series of what we like to call process improvement events, taking a look at how we're doing our work, what changes we can make on our end to do any kind of cost savings so that we can continue to care for as many children, as many families as we can. So wanting to keep these relationships with you all, and we understand these are your businesses. We just want you to understand that we are looking at all the options that we have. So that is part of why we've not made any firm decisions on which direction we're going. I know other counties have, but we do want to take the time to explore our processes, how we can improve them, change them, be more efficient, and continue to save money and take care of as many children as we can. So we just ask for your patience as we work through some of these things, knowing that we will share information on any decisions we make in giving you that 30-day notice. But again, we've dropped the email in the chat. We are definitely open to answer questions at a later date. You have 2 email addresses in there, depending on which side of the CCAP program you think the question would be best suited for. So please feel free to reach out to us with additional questions if you need further clarification or would like to have smaller conversations with us. We can definitely look to arrange those. So I think that's all that I have. I'm not sure if anyone else from the DHS team would like to add anything.
Tasha,
I'm
can I
gonna
ask
hop
a
back
question?
in, sorry.
I'm sorry, yes, please.
Is there any opportunity for providers to provide any input or commentary on the decision-making process or whether a waitlist or freeze would be more effective for their program or anything like that? Like, is there an opportunity for provider input on any of that? Or is it
Yeah,
more
we
of an
definitely want to hear your
internal process?
voices. I'm sorry, Dora, I didn't mean to cut you off.
You're totally fine.
That's
The
why we
nature
have
of
the
virtual.
information in the chat. And I think we've got it on screen here for you too. You know, we do foresee that we are going to have to make some changes, but yes, we do want to hear your thoughts, your comments. We want to look at everything before we make a final decision. So please share any thoughts, feedbacks, or comments that you have through either one of those. And I know there may be providers that weren't able to make this call today. So I know, Dora, I believe you send out a blast so that they will get the same information. So I know you all probably are a pretty tight community. So as you're talking to your partners, please let them know that we are open to hearing people's comments as we finalize our decisions.
I do have a question. So since in the future we might move to the enrollment based, will there be a, and I'm very new to this. So right now, anyone who applies who meets the eligibility criteria can get approved for CCAP, correct?
Correct.
Okay.
Correct.
But when we move to an enrollment model, does that mean that there would ever be caps where, like, I guess I'm just wondering how that will be impacted. Like maybe the whole center, only 80 spots or something can get CCAP funding. Is that
So that cap wouldn't happen until the county makes a decision on a freeze or a wait list.
okay? But it has the potential to occur down the road in 2026.
Or sooner in regards to the wait list or freeze. That's a county decision. So that can, you know, happen a lot sooner than 2026.
Just to be clear, the 2026 date is for the enrollment, which is a future change, and we'll, I'm sure, meet many more times on that. But it is something that's forthcoming, and hopefully, you know, the end goal there is to get more dollars to each of the centers and stabilize your revenue sources so that it doesn't fluctuate with people's attendance or not. But the waitlist and freeze is something that is being considered right now. And if we decide on that, would be forthcoming, you know, soon.
Okay. Thank you.
And with that change coming in 2026, does would the county be open to maybe even having like a provider task force on what that may look like with regards to the enrollment versus attendance model? Would they be open to having a task force to maybe discuss those impacts and how that may look for providers and maybe ways that we could minimize the impact to providers?
So I'll just throw in a couple of things. I think just so we're clear on the enrollment, we're using the word impact, and obviously there's going to be a change, but when that happens in 2026, the change will provide more revenue, consistent revenue to the providers.
Yep.
As far as the impacts on the you know, how will the attendance be tracked, or how will we have to do notifications, that definitely is being discussed at the state level right now, and is somewhat going to be determined by the CBMS. But as soon as we get some guidance from them, we certainly want to then have further discussions, you know, in this type of venue right here and get
Right.
feedback as well.
Right,
Since
and when
it would be a little premature for us because that is still 2 years down the road, and
absolutely.
certainly though, as we get closer, we will need to, have, those discussions with everyone.
Totally agreed. And when I meant impact, meaning just it was mentioned earlier about after so many absences, we would need to report that. And just so that providers are remaining in compliance, I just thought it would be a great idea that we be a part of that conversation when we do move to that. But that is definitely something for down the road that we can certainly take up at that time.
We certainly can talk to this. I don't know, since most of these rules are being, are enacted by the state. I don't know if they are currently doing vendor groups and getting feedback on that. I would imagine that's going to be further down the road, but we certainly meet with them on a regular basis, so we can reach out and find out if they are having those meetings, and when they do start having those meetings, communicate that to you all to be able to participate if you wanted to.
Thank you so much.
So I just wanted to touch base on some of the changes that will be occurring with the legislation changes. There's 16 total things that will be changing between now and 2026. So as of January 2025, they are adding a 12-month eligibility for children. And so what this means is, say that there is a parent that has a child, the child will be able to receive a full month 12 eligibility. And so what that means is, say the child is born in month 11 of the current CCAP authorization, then the authorization will be extended out for the entire family to allow the new baby or the new child to be able to receive a full 12-month of eligibility. So again, that will be updated into the system as of January of 2025. For our qualified exempt providers, they are updating the background checks to also include child pornography. This will be updated in the system as of January of 2025. Coming in August of 2026, again, you've heard previously that they will be limiting the parent fee to 7% of the income level for the family. We will be increasing consumer education. And what this means is that it will help families to be able to find our application, calculate what their possible parent fee will be, and also help them to plan on if CCAP is something that will be relevant for their family. We'll change from attendance-based to enrollment-based. We've already started the rate increase project that was effective as of, well, it goes into effect as of October 1st. We will be paying providers in advance. So right now we pay providers weekly, 2 weeks in arrears. We will be moving to paying monthly and paying you guys at the beginning of the month. That will be effective as of August of 2026. We will have now be paying the registration fee as of August 2026. What that looks like, again, the state is still telling us how that will move into play. We will have slot contracts that we will be required to hold for providers. And what this means is that we'll have certain populations where we're required to make sure that they have a spot. So current geographic areas, infant and toddlers, children with disabilities, and family needing non-traditional hour care. So some of those families who may be nurses or work overnight will be able to have slots for those families. Orvalet already mentioned that we will be looking at the application and redeterminations to make sure that we are only covering what actually needs to be covered in order for those families to receive care. As of July 2025, we will have a qualified exempt pilot. And what this will be is allowing any friend or family who wants to become a licensed provider to take the training and work with the licensing team on how to become a licensed provider. Any questions so far on any of that information? I know it was a lot.
I do have a question. What about the legal status of applicant? You know, like we have a lot of people coming from Venezuela, and so can they apply for CCAP, for example? You know, those kind of, they don't
So I
have
can
it.
take, yeah, I can take that question. So for CCAP, the child must be a US citizen. The citizenship of the parent is not considered.
And if they are not citizen, they cannot apply for the CCAP, right?
If I was not a citizen, we will not be able to authorize care.
Okay, thank you.
To go to a question in the chat, one is, what exactly is non-traditional care? Non-traditional care is any care after 6 p.m. going up to 6 a.m. And that is considered non-traditional care. And I believe there are special rates for those for care being provided during that time. Also, there's a question in the chat, Angela, what about increasing the rate for children with special needs or disabilities?
So we also, when we looked at the rate increase project, we also looked at all of our current rates. So there is an additional rate increase. It was a 2% rate increase for Denver County providers that were included for special needs or disabilities. So if you are a center that offers that, you can reach out to me directly to make sure that we have that correctly showing on your fiscal agreement. Any other questions? So Dora, we'll pass it back to you.
Okay. I'm just kind of trying to look at any of these additional chats. I will just kind of pause for like maybe a minute for people to add any additional questions they have in the chat. I also, you have to scroll up a little bit because at this point it was back there for a ways, but we do also have the Denver CCAP Collaborative, and that is a meeting that we have quarterly with Denver Human Services staff. And that's another place much like this where you can kind of get updates on what's happening, ask questions, and kind of figure that out. So I'll put that in the chat again as well. So do register for that if you have a high population of CCAP families, just because, you know, it can really help you stay on top of some of the things that are changing. I did also see that there was a delay in processing. Orvillette, did you want to speak to that while we're here?
Sure. So we are currently in a backlog. We've had incredible increase in requests for child care assistance. We're working at about 30 to 60 days behind. And I would say this started in about April of this year is when this backlog has started. We are trying to answer as many questions and phone calls as soon as possible, but we are, again, for a county that has been about 95% timely, we are behind right now. So we just ask for patience. We also ask that when you contact us about inquiring about a family, confirm that they're enrolled or we'll have a space. That is what's slowing us down. We need to confirm enrollment before we create these authorizations. Clients are saying, yes, I want to attend this facility. The facility has no idea who this client is. Then that's just extra work, bringing that back, getting the absence payments back. So we're asking whenever you contact us about a family that you can confirm that there is a spot for that child. So when we get to that information, we can process it and authorize the care as requested. Any questions about that? And we have set up that new email address, ccapproviders@denvergov.org, just for you, because we felt like your communications were kind of getting lost in the overall bulk of questions that we're getting from clients. So I see that some of the client providers have been using it. I have been communicating with you, as well as Tiffany Lee, who is the provider specialist, who unfortunately couldn't join us today. But please continue to use that chat, or excuse me, that email address, and we will get back to you as soon as possible.
And to tag on to Orvalette's last message, if they go through the process and notify you guys that that application or redetermination is complete, they are also notifying us that you guys are able to manual bill. So you can also submit your manual bills once they have told you guys that your application is in a good standing.
Great. Can someone from Denver Human Services just put the billing office email again and the eligibility side email again, just so we can kind of have that towards the bottom? Awesome.
I did have a question just from some of the chat items. Someone had asked when looking at rates how they know what their tier location is. And someone else responded that it's based on the quality level rating. But if that's correct and it's based on the quality level rating, at what point could a new center apply for a fiscal agreement? Because it would theoretically, they'd have to be like a level 3, right?
So you can, once your fiscal agreement or once your license is opened, then you can apply for a fiscal agreement with any county. We don't necessarily look at your quality level. So once state licensing tells us, or we can go into the system and see that your center has an open license, then we can create a fiscal agreement. In order to get those higher rates, then you do want to take the training through your Colorado Shines in order to move from, say, like a level 1 to a level 5. So as you guys take those trainings, then we are notified in the system and we'll go ahead and update your rating in the system based off of what training you guys are completing.
Okay, so even kiddos without, maybe I'm confusing Denver preschool program. Because for one of them, I thought you have to be at a level 3 in order to receive funds, but it sounds like that does not apply to CCAP.
Jambrea, just so you know, all of those organizations, when you're a new center, will let you in. You just have to let them know when you're going to start applying for Colorado Shines. They'll let you in at the lowest level, and then you climb to the better levels once you've gone through Colorado Shines. You are given months, like for instance, DPP as well as CCAP knows that it takes a couple of months to go through that process.
Okay, awesome.
Very good question. Very good question, though. Just so you guys know, we have a new center opening up, and Chambrea will be the director. So there's a lot of iffy things being a new center just opening in a couple of months.
Rhonda Lynn had a question in the chat about UPK. Can one of you guys kind of explain how the blended and braided funding kind of works with stacking UPK and DPP, and like what that looks like when you're getting reimbursed from CCAP as well, just so we can have a clear idea of really what that looks like?
I can give you the very basics. So UPK is Universal Preschool Program, DPP, Denver Preschool Programs. And currently how it works is that if the child is receiving CCAP, maybe in the preschool program, they can apply for UPK and DPP. Right now, the funds are being stacked. So based off of how many hours they're approved at DPP or UPK, it could either push their CCAP hours to full-time, or it will just keep them at the regular rate. But right now, funds are being stacked, so they can possibly get funds from UPK, DPP, and CCAP at the same time. I hope that helps.
And can you just add to that? Because we have received emails from providers stating, listing children that are receiving UPK funds. we cannot take any action on their existing CCAP cases until the client reaches out to us and says, hey, I can reduce my hours from 10 to 5. So just because you're receiving funds from CCAP and UPK, you're not in violation of any rule or anything at this time.
Thank you for that.
Also, we want to mention that UPK as well as DPP, if you're in Denver County, those are 9-month funds. They do not go 12 months. So that's why CCAP still is invaluable, because some clients can't afford full price after those funds run out of the 9-month segment for the year. And it is both programs only for 4-year-olds, for those children the year before kindergarten, unless there's a special situation with 3-year-olds with both programs.
Any other questions? Go ahead.
No, I was going to ask the same.
Okay.
I'm
So,
sorry, I have one question. You just said for FFN, it's 24 something per kid, but per day. Is that for full-time or for part-time? Or they are different rates for part-time?
It's a different rate for part-time. Give me 1 second, I can tell you what that is.
And part-time consider anything under 5 hours, right?
Yes, full-time is considered 5 hours and 1 second, and part-time is 5 hours or less. And the rates for part-time will be moving to $19.67 as of October.
Thank you.
You're welcome.
Angela, is that information posted somewhere where we can reference it, or is that something that we would always need to email you to get for specific?
It's different for each county, what they pay for their qualified exempt. The state will release what the rates are. And I think someone else had a question earlier about your rates, your private rates are different than the rates that you actually submitted. And so that's based off of the ceiling rates that the provider pays for us, and also what your quality level is. So if your quality level was higher, then we'll pay closer to what your actual rates are. If your rate is lower, then we can only pay up to the county ceiling on those. So yes, you can find the rates by going to the CDEC and looking up county rates. But if it's Denver specific, you can also reach out to me and I can get those rates for you.
Oh, awesome. And then final question is just, so the timeline for a new center would be that we can apply for the fiscal agreement as soon as we have our license. But because no, never mind. I answered my own question.
Okay. And I think Tasha mentioned this earlier. Myself and Tiffany, which is the provider specialist for the eligibility departments, if you guys do want those one-on-one meetings with us, we do either come out to your center or can do those virtually. And we'll usually go A to Z of CCAP and the business office. We talk about eligibility, we talk about your manual claims, your recoveries, any of that information to kind of get a better grasp of how to effectively run your CCAP program. I know Dora also offers a portion of this too, so you can always reach out to myself or Tiffany if you want to have that one-on-one for your center. Any other burning questions that you guys may have?
I would really encourage you guys, if you do have like personal, like one-on-one situations or kind of complex things, like do reach out, because the staff at DDHS is amazing. So if you do have something where you're like, well, then the parent told me this, and I don't know. Like, it's easier to just build those relationships and have the person that you need to talk to that can answer those. These groups are great for kind of larger questions, updates, but that one-on-one really is really helpful.
Sorry, Dora, can I say one more thing?
Definitely.
Another good tool that you guys may find helpful is your provider handbook, which you can find at by going to cdec.colorado.gov. And this will also answer the basics of any provider questions that you have. On the fourth Wednesday of every month from 12 to 12:45, the state offers a provider forum where you guys can also get these questions answered. If you're having ATS issues, if you're not sure how to set yourself up, you can also attend that. And then on the first Monday, which the next one would be October 9th, for any qualified exempt providers, you can also go on to those support meetings and they will also answer those questions. How do you become a provider? What does this look like for me? You know, are there any changes or anything? You guys can join those support sessions with the state.
Can you please put that link in the chat, please?
I sure can.
And excuse me, I already put the link in the chat to the provider website. Oh, there it is.
We have a question in the chat. Is there any news on if or when we'll be able to submit manual claims / recoups through the ATS?
Through ATS, no. I know they are working on a new manual claim form. Whether they're going to make that digital, I don't know, but I can put in a support ticket for you guys if that will be more helpful. And thank you everyone who has submitted your calendars for the 2024-2025 year. If you have not, please submit those to us. We want to try to avoid as many recoveries as we can this year for not being able to update that information into you guys' system. So if you haven't submitted your calendar request, you can submit it to the provider payments at denvergov.org and we can get that updated to your fiscal agreement.
Can you tell me more about that, or is there a way to a person to check with if they have received that from our center? Or
What's your center name?
well, I'm up to, but Warren Village at Gilpin.
I haven't seen a calendar come across for you guys.
Okay.
Can I
And so
ask a question? I'm with New Legacy. I sent mine at the end of May. Is that a good time for me to send like the following year's calendar and do you guys have it?
Yeah, if you've already submitted it, then we've already put it in the system. It's just for those ones. If you haven't sent one for the year, then we're requesting that you send one in. Moving forward, you guys will get a reminder from us either late May or as early as July, requesting for you all to submit your calendars for the upcoming year.
I see that people are kind of hopping off, so I'm going to do another shameless plug for the CCAP collaborative. And then also our next lunch bunch will be with Lucy. And she recently went to Finland, so she's going to be talking a little bit about what their early childhood system looks like, how it's different from our own, and like lessons that we might be able to take away from how they fund their early childhood system and what some of those differences are, as well as just the accessibility. So that will be kind of a similar thing, you know, feel free to come. Listen, the link to register for that is also in the chat. If you want to stay to ask more questions, you're welcome to. Otherwise, the rest of this will be recorded. So if you feel like you missed anything towards the end, you're welcome to watch the recording as well. It's been great to see you guys. Definitely reach out if you guys have any questions.
I do have one question. Hi, I'm Melissa, Care. We have experienced that the new rates that are increasing in October, some of them are over our current rates of tuition. Is there anything we need to do to capture that? It was recorded in our physical agreements, but is that something we need to recoup the money for you, or are we allowed to earn that overage?
That would be based off of, so whatever rates that you guys have submitted to us, that's what we'll pay as far as your actual rates that we pay to the center.
So the
If that
daily
makes
rate
sense.
is going over our tuition currently with the updated rates as of October 1st.
Right. So the system will look at whatever rates that you provided to the county and pay based off that rate. So if we need to talk offline, Melissa, you can call me.
Okay, thank you.
You're welcome.
All right, any additional questions? If you feel like you've got what you've needed, feel free to hop off. But if you have any additional questions, you're welcome to kind of hang around. If it is very specific to you and your situation, it's probably best to just contact the emails that we have in the chat. It was great seeing you guys. I hope to see you at the CCAP Collaborative.
Thanks, Dora.
Thank you so
Thank
much.
you. Thank you guys. The Denver
Thanks,
Human Services
Dora.
for coming. Thank you.
Thank you for having
I'll
us.
see you soon. Yes, this is very informative. It's really helpful. I know it's like a lot of you guys, and I appreciate the coordination that it takes to do a virtual meeting. So I
Well,
really
we wanted to
appreciate
show
you.
up prepared so we can answer as many questions as we could. So
Great.
all right, thank you.
Thank you, Dora. Good seeing
Have a
you.
great
Thank you.
afternoon.
See ya.
Hey guys. See you later.
Bye.
Bye.